everybody. Really pleased to welcome today Kate Arlott, who's going to come to talk to you about her own personal experiences of stroke. I'm sure it will provide all of us with a really useful insight. So I think Kate is just going to tell you the whole story. I don't need to say anything at all. But Kate, we very much look forward to this, and I know also this is going to be recorded, so we'll keep very, very still. Thank you.
Thank you. Thanks all for coming. I know it's only for students. I'm just going to take you through, this is my first lecture. There are lots of presentations. I do that with my arms a lot, I gesticulate. But really, this is my take on why I'm here now doing what I'm doing, and that is talking far too much, as my husband would probably agree with. So yes, unlocking the keys of my stroke recovery. On the 7th of February 2010, let's get a pen to show you this, I had a huge brainstem stroke. I was put in a coma for 3 days to shut down my brain, and basically what that means is if you look over here, sorry, this jagged line shows you all the blood clots that were in my brain on the right pons, and over here you can see it again on this one here. So that's what happened to me. But when I woke up from my coma, I was only able to move my eyelids and my eyes. Nothing else moved, no muscles, no nothing. And that was all very fearful and horrible, and you can read all about that as much as you like, but that's not my focus today. All I would say is I was totally paralysed, but I felt everything. So I could feel Mark touching me, or he'd often massage my forehead throughout ICU, but I could feel everything. I could talk, I couldn't walk, I couldn't talk, I could just blink for 6 months. There was a television in my bed, there was a nurse at the bottom of my bed. After 2 weeks I had a tracheotomy, because I was breathing on a ventilator up until that point. I was peg fed, catheter. There was basically nothing happening apart from my brain was still the same. I was still me inside. There you are, some fairly awful pictures of me. The first one is the first 2 weeks when you could see that I had the tube in my mouth. They had to take that out because I was tube tolerant, and they were worried about that. If I ever did speak again, I wouldn't if I had this in my mouth for so long. So they then fitted the tracheotomy. And that picture over there is not glamorous, I know, but it's very much, my eyes spoke volumes when I was in ICU, and that was I learned how to swear with my eyes. As my husband pointed a camera at me, you can imagine, I'm very grateful now he did, but at the time, it wasn't something I wanted. So I think you can all guess what I was thinking. Just to give a bit of an idea of what it was like, I was in bed, I had my hands in splints. There was a television on an arm, there was a clock above the wall that was just like that one over there. And the nurses were too busy keeping me alive, watching my stats and everything else. Their priority wasn't my television, my space, my environment. So I'd often just lie there looking at a clock, and every day, the minutes, the hours, it would just drag. You couldn't punctuate your day with any food or drink, like we all do now. All I had was a wall, a clock, and a television that was never turned on. So one of the things I'm very hot on is that, you know, I couldn't read a book, I couldn't do anything. My mum, I have to tell you this, my mum came to visit me one day in ICU, and she was desperate to know what to do to help me. And in her wisdom, she thought that she'd leave me with an iPod with earphones on. Great idea for an hour. Loop, loop, However, the choice of music she chose for me to listen to for an hour was country and western. I nearly went mental actually. But the other thing that you might not realise, but for me, because I was a 70-mile-a-week fell runner at 39 when the stroke happened, I had terrible shortening of my muscles, and I had the most horrendous cramps. I couldn't tell anybody about it, no one knew about it, I couldn't believe, I couldn't do anything about it. And it was almost, that's why there's a picture of Mark there with the blindfold on, and every 4 hours I was moved and turned, but it felt like, well, for you, I'm trying to convey this idea that it was just the awful weight on my legs and the pulling, we all know what cramps like, it's just horrendous. Just have to go through it. I've heard from other people that cramp is an issue as well. Now this might be interesting to you as stroke speech students. Very early on, my friend, one of my best friends, Jackie, when they still thought I was in a vegetative state, I wasn't, I was always very alert. They smuggled in their own made letterboard. It's A to Z on a basic piece of paper, and Jackie said to me, Kate, we're going to find out what you want today. When I point to a letter and it's the letter you want to spell out, you blink twice for yes, once for no. Anyway, we gave it a go. Started at A, went all the way to S, and I blinked twice at S. It was hard work this, by the way, I have to tell you, it was really, really hard work. Then she went from A all the way to L, and I blinked twice. And then to E, blinked twice. And she guessed sleep. I blinked twice, so she didn't have to spell the rest of the word out. Then she said, can't sleep, and I blinked twice. And then she said, at night, and I blinked twice. And for the first time in 3 weeks, I'd actually been able to communicate. I can't tell you how important that was for me. It was like I talk about it in my book as a carver bottle erupting. It was just like that. It was like, thank God for that. The swear word was, I should have used it in my head at the time. But it was so important. However, we progressed from her homemade card to the ICU card. And the ICU card was just like this one on here, but it didn't have an end of word box. Now, Mark, my darling husband, would try and work out, it was very hard to work out whether it was a blink, was a deliberate blink or not a blink. He was looking at the thing and not looking at me and missing it, or I wasn't being very specific. So I'm spelling out, but I told you I had cramps, leg cramp. So I go L, and he goes, you go all the way to L, blink twice, E, blink twice, G, blink twice. And I'm looking at him thinking, that's the end of the word. That's the end of the word. And he goes, right, start again. C, Kate, you've lost your blooming marbles. There's no such word as GC, you know. And I'm thinking, end of the word, it's the end of the word. And I had no way of telling him or communicating to him that I'd finished. And that happened so often, there was such a lot of confusion, that my loved ones would persevere on a word with me, which could take 20 minutes to spell out, it was that slow. And then, you know, their frustration, they'd give up. And then you just feel as if you've not said what you wanted to say. So that box is so critical, end of word. Week 8, all I had nothing for 8 weeks. Week 8, 1 millimetre right thumb. And it was, Mark was quite excited at that. But I was thinking, well, so what? I can't do anything. Brush my hair, do my teeth, have a shower, and it meant nothing to me. Now, I've fast forwarded a bit here for the purposes of yourselves, but I was in ICU, just bringing you up to speed, I was in ICU for 9 weeks, and then I went to rehab. And I have to tell you the story. After 6 weeks in rehab, there wasn't a great deal of obvious progress I'd made. I thought I made a lot. Clearly no one else did. We had a meeting, a 6-week review. In that meeting was the therapist, the neurosurgeon, the doctors, the nurses, my loved ones, Mark, my mum, my best friend, his mum, and it was like, and me in a wheelchair with a headrest, dribbling. And I was actually really excited about it because it felt like I'd made some progress. And wheeled into this room. It's actually the rehab consultant opened the meeting and said, "Welcome everybody, nice to see you. I've nothing more to add." And I was like, what? So that was the first shock. And then after that, everybody around the room, and all the medical team, the nurses, the therapists, said, "Well, I've nothing more to add." And I thought, it was very quickly apparent to me they'd all given up on me. You know, because shortly later on in that same meeting, before I lost the plot totally and had to be wheeled out, they were talking about my long-term care in nursing home. Now, as you can imagine, I was devastated. Mark has his own take on this, but that was my take as the patient. I was wheeled out by my best friend and my mum. I was hysterical. And they got the communication board out and thought, well, she needs to communicate here something. And what I spelled out was the words, "stand by me." And up until then, I'd pretty much given up on life really. I wasn't overly fired up, I glazed over, I got no fight in me, nothing. But will be surprised, I'm not the kind of person that's ever sat back and done the thing. And maybe that was it wasn't deliberate, but the strategy, but it was a kick up my backside to really say, I don't know if I'm going to get out of this, but now is the point at which I'm ready to try my best to do everything. And it was in May, and I call Magic May, because shortly after that meeting, my whole attitude, my whole approach changed. Every time I was asked to do anything, whether it was neuro, whether it was physio, whether it was OT, whether it was speech, and there was exercises put on my board in my bedroom for my loved ones to do with me, from oral motor to swallow to tongue, base, middle and end of tongue, they'd say to me to do it 5 times a day. Because if they said any more than that, then they might put me off from doing it at all. But this is Kate they're talking to. They say 5 times a day, I'll do it 30 times a day. And that's what I did every single day. And every day I took a different part of my body. So this was out of sync really, but it's just wanted to show you I did use at one point, you see the communication board here, I used the thumb to activate the grid 2 communication system. In fact, my loved ones were saving up for me to get one of these, but I'm thinking, why would you do that? You know, I don't see this as a permanent fixture. They all thought it would be. But it was just to help me at that time. That's how I saw it anyway, because I was good, then we're going to get better. Anyway, one of the other defining moments, I have to tell you this, I didn't know about neuroplasticity, I know now. All I could do all day was nothing. I'd just lie there watching Demi Kyle, This Morning, Antiques Bargain Hunt or whatever else, and Alan Titchmarsh doing his interviewing on, you know, it was dull as dishwater. But all I would do is lie there and just take a piece of my body and think, right, I want to bring that back to life, or I want to get this working, or I want to get that working. I'll tell the story because my husband said, the first time this hand developed from doing basically just a couple of movements here to that movement, it was my party trick on a pillow on a wheelchair. Mark came to visit one day in Osborne, and he said to me, show me your trick, and of course I was really giddy. I didn't say anything because I couldn't, I just went, he went, yeah, but now move it back. I couldn't do it. And he spent the whole hour with it, not moving it back I think you've got to do it yourself. And it was such a pain. But anyway, it was funny. So I'd take a part of my body, and one part of my body that, in my mind, Kate's world, I thought, right, okay, I want to run again. That was my start. When I typed that in the nurse's station computer, that I will run again. I mean, I was in a wheelchair, I couldn't even walk, but I was going to run again. That was my objective. And I was going to walk out of the hospital board. They were my two major goals, and I think that's very important, as are bite-sized goals. But I thought, well, this side's coming back slowly. This side did nothing until the end of May, from February. So I took my left big toe, and I lie there in bed, and I stared at it, move, damn, move it. And I was just talking to myself in my head all the time. Weeks and weeks and weeks I did this. After a few weeks, I got the tiniest flicker. Alison came to visit me one day and she just said, Kate, did your toe just flicker there? And I just said, I couldn't move my chin, I just rolled my eyes. And she was really excited. But from that, the rest of it all came back to life. But at the time that happened, that 1 millimetre bit of movement, after all that willing and all that trying and wishing and hoping, I visualised it. This is the God's honest truth. You know the fun fair when you have the test of strength game? You can see the picture up there. I visualised every day the nerves, I didn't know about pathways, would get longer and longer and longer. I knew they only grew 1 millimetre a day. And eventually, if I think hard enough, it'll be like being at there. So at the fun fair, when it actually got the movement was when I metaphorically hit the bell at the top. That's how I visualised it. And then I thought, when it did happen, I was ecstatic because I thought, if I can move my left toe, that being the farthest place from my brain, then game on for the rest of my body. That's what I thought. So that was quite an important day for me, that. Now, this might interest you. Mark drove me down to London last year because I was invited by the UCL for research to rescan my brain. And what they discovered, this, you know that picture I showed you earlier, this is my brain now. They can't, that's the blockage from the blood clot. Right over the area of the brain that affects your movement and everything else. And they'd hardly, well, they hadn't seen anything so severe, they couldn't explain why I'm doing what I'm doing. Because that's my brain now. It's rewired. Now, I just want to really, my story, I've given you a bit of a potted one because I really want to focus on the speech stuff for you. But just to give you some idea of what happened to me. From February to the end of May, I had no movement at all, apart from this little bit of movement and this little bit of movement. I had the trachea, I had the peg. I was often very thirsty because of that. I did many oral motor exercises, and when they said 5, to hell with it, I did 30, or more. Every time I thought about it, I'd just do them. Nothing would happen. Mark can verify it. They'd sit there and say, right, well, stick your tongue out. And I'd be thinking, my tongue's coming out. And there have been great loved ones in there saying, that's amazing, that's brilliant, that's fantastic. I wasn't doing anything. I felt as if I was. I thought, oh, brilliant. No. Or open your mouth wide, or touch the roof of your mouth, or behind your teeth, or, we did it every day, and at one point, on a number of points, they actually got fed up of doing it because they knew it was almost cruel to let me do it because I couldn't do the exercises. And I actually, with my eyes, got really angry with them because they'd come for a visit and they'd ignore the exercises that had been put on the wall by the speech and language therapist, and I'd be looking at them like that. Because they'd want them to do them with me, because I felt that's all I could do all day was exercise. So, there was an awful lot of oral motor, there was a lot of tongue, we progressed on to letter sounds. But I have to tell you this first, this story. This is the truth. My son and all my kids came for a visit one day. My youngest son, Woody, I was writing at this point on a piece of paper, I couldn't speak. And he came very naively and he said, "Oh, Mum, don't let me write my name, say my name." And it was so naive. And I just said, I mustered up all my strength and I said, "Woody." It wasn't that clear, but it was the most noise I'd made since February. And then of course, all four of them were like, "Say my name, say my name." Like some performing monkey. And Mark was the most difficult. There was no way I could do an M or a K. So anyway, they toddled off and they went home and they were all excited. But what I didn't tell you was, 2 weeks before that, Mark was told by a very conservative speech and language therapist, lovely, she worked tirelessly with me, really brilliant. However, she told him on the phone that it's unlikely I'd ever speak again. Well, she didn't actually say that, she said, "Kate won't speak again." So this was 2 weeks later. So never say never anyway, it's one thing. However, what the interesting part of this story is, all weekend, in true Kate style, they got the noise, they got the inspiration, I practiced. Comes Monday morning, and there's my favourite nurse, male nurse. He wasn't gay, and he was very funny, and he was not a great nurse, but he was funny, and he made me feel normal. And he came in with a box into my room, and he said, "Morning, Kate." Oliver, this was. And I said, "Morning, Oliver," and then dropped the box. And he went, "Oh my God, it's moments like this that I came into nursing," and he ran off the speech therapy. And she came back, this very conservative speech therapy, I liked a lot actually. Worked with the Go Out girl, some of you all know. And she came in and she'd always been very calm and cool and collected. She goes, "Say anything, say anything." And I said, "Hello." Because I didn't know, what I didn't tell you is I didn't know they'd had that conversation. So I was like, "What's your problem?" You know, but after that, they ramped up the exercises I did. Both speech, oral motor, mouth, swallow. I still wasn't eating at that point. I had 2 video fluoroscopies that had failed. Well, I failed one at that point. They introduced exercises, like for example, because of the risk of silent aspiration, that was lots of pneumonia when I was in the hospital. I was obviously totally nil by now, so they couldn't help my swallow function by giving me practice. But what they did do was they put a teaspoon in ice, not iced water initially, ice, so it was dry, and they put the teaspoon on my tongue to try and stimulate this swallow function. And maybe they'd do it 10 times, and after 10 I'd get 1, and then I'd get maybe 2 or 4 or whatever. And that's what happened. That was a safe way to try and help me practice my swallow. We then moved on from that onto 10 teaspoons, because you don't know more than me, but you drown after 30 mils of water, I think, in your lungs. So we progressed to 10 teaspoons of iced, chilled water. And then we had to stop. So we did that 4 times a day. And then when I mastered that, they introduced the ping pong ball, which is like the most bizarre thing to me. A straw and a ping pong ball. The straw to help me lip sync and blow out air, because I have no capacity. I think my lungs are totally destroyed, as they are a muscle, in terms of the capacity. So I couldn't blow anything, and I couldn't lip seal. And a ping pong ball as well, so that when my speech therapy assistant was there to place the ball on the tide, and I was in the wheelchair, she'd hold the straw up to the ping ball, and I'd try and blow the ball. Well, obviously, I had no lip seal, and the ball didn't go anywhere. But after weeks and weeks of doing this and being driven around or going around in my electric wheelchair on the hospital with the straw hanging out of my mouth like a cigarette, so I was just practicing continuously, I was able within a few months to actually blow the ball all the way off the table. So it was a great exercise actually. But in between, while we were doing all that and I was making progress, I had my second video fluoroscopy, which was, I think both me and Go8 Girl were very, very enthused about, because we thought for the first time in 6 months I'd get the green light to eat and drink. We went down there, and in the first minute we were in there, and a horrible, horrible doctor who hadn't realised I'd actually learned how to literally, behind this screen, the radiation screen, said to her colleague, well, no change there then. And I could see that, and I was absolutely shattered. I was the most lowest I'd ever been, because it was such a big day for me. And she actually apologised to me later, because she was very unprofessional in the way she talked. Because we'd worked so hard, and within a second she'd destroyed everything, you know, all the effort I put in, and it was horrible. But a bounce back, I've called that a bit like Tigger, bounce back on everything. So the other thing that I think is important for you to know is I had hundreds of assessments when I was in hospital. And there's something, I know this from my charity, there's something about an assessment with a doctor, whether it's male or female, in a white coat with a stethoscope, and you know, as a patient, you've got to perform, because either you think in your mind, if you don't, you're not going to go to rehab, or if you don't, you're not going to eat dinner, or you're not going to have a drink. So this, that, and the other. The pressure there is on me to perform. I didn't not perform because I was being difficult. Quite a lot of loved ones think when they see their loved ones doing something, and they say to the nurses, well, they're moving their arm, and they do it, and they don't do it for the nurses. It's like they almost think the patient's being difficult. But for me, it was about the spotlight. It was like, you know, it matters so much. If you don't pass this, therefore you can't do it. And I think the pressure of assessment is something you need to be aware of, because I'm not the only one that happens to certain patients. And I would really truly say, I know it's not PC, but there's 5 a day. Yes, you've got to know your patients, and not everyone's like me, of course they're not, thank God. But equally, you shouldn't underplay things either. I honestly believe, you know, you've got to practice the muscles as much as you physically can. I mean, I'd tire myself out, of course I would, but within 20 minutes I was actually okay again to go again. You know, what they used to do initially with me, especially in physio, I'd tire very, very quickly, but within an hour of physio I might have been wheeled back to my bed after 10 minutes. Give me a 10-minute break, then start again, you know. Not just assume for the rest of the day I don't have to do anything. One thing that I really think you should have, if you haven't already, I'm sure you have, is the iPhone app or iPad app, Lingraphica Speakeasy. It's free, and they do an app for ICU, they do an app for dystharthria, aphasia, all the letter sounds. It's just brilliant. Have a look through their whole thing. It's absolutely amazing. Speakeasy, Lingraphica.
February this year, Kate Allen came, was from Sheffield, came in to have a chat with Boyd about a challenge that she set herself.
Yeah, a couple of years ago I did a challenge, which was the 3 Peaks Challenge, with work colleagues, which was a fantastic experience. It gave us more focus, and it just lifted my spirit. I'm a raised load of charity. And with the big birthday approaching this year, I thought, you know, I could probably do with another focus, just to brighten up the week, basically. So, dreamt of Kilimanjaro.
Kate Allen's trip never happened. She went on a different journey altogether. Kate joins me in the studio now to tell us the extraordinary story of what happened next, Kate.
On the
I had a blood clot on my brainstem, and it left me in a coma for 3 days and on life support machine. And 3 weeks later, the doctors realised I could hear and blink, and every bit of my body was paralysed apart from my eye. And they introduced a letterboard for me to blink to.
Did you, where do I start? Did you think you were dead? Did you think you were dying?
Absolutely. For 3 weeks, I thought I was dying, but if I'm honest, I wanted to die.
Did you?
Yes.
That'll give you an idea, really, as much as anything about the voice and how it's changed. It's 2 years, just over 2 years that I left hospital. Okay, so I'm just going to tell you now a bit about how my life's different. It's not worse, and I think that's really important for stroke survivors. It's happening to so many people nowadays, especially young people, and a lot of stroke survivors feel that their life's not worth living, or it's really rubbish now. I mean, I myself, I had so many issues. We went to see Calendar Girls last week, and I was wearing my look, they're feminine, and every girl likes to wear heels. I wear my little black heels, and I walk like a transvestite. And, it's not glamorous, but I feel good in it. I feel like a woman. And this man at the bar at the Buxton Opera House asked for small wine. He said, "Don't you think you've had enough?" I thought, it's 2 o'clock in the afternoon, no. So I know people assume all sorts of things. I mean, I've had so many situations like that. But I think also people have to realise you go through a grief with a stroke, with any illness, but you have to find a way to bounce back, and it's a new life, it's a new normal. It's not necessarily worse, and mine certainly isn't worse because I feel like I'm able to give back to people that like me that can't speak. Sort of things I have now is I laugh a lot. Now this is called emotional lability. I laugh and I cry. I'll give you an example of one of my worst situations. I was at my best friend's father's funeral, and just as the casket came in, I was actually inside getting very emotional and sad because he was a nice man. But actually what came out of my body was hysterical laughing. I was mortified. And the more mortified I got, the more I couldn't stop it. Fortunately, obviously everybody knew me at the funeral, and they understood and they patted me on the shoulder and said it's okay, because they knew that. But, you're disappointed with yourself. I have no way of controlling it. I know with other stroke survivors, one of the biggest issues they have is the emotional lability. They cry like that. I think a sad thought and I cry now. I never used to cry. Or I think a happy thought and it comes out happy. Or, for example, we've got 3 kids and they upset us sometimes. You'll get to know about it. And initially when I came out of hospital, and they'd fight or something, and I'd try and reprimand them, I'd get angry. The more angry I got, the more I laughed. And then they'd think, oh, Mum's having a laugh. And I'm like, well, I'm not, I'm getting more and more angry. And in the end, I had to develop the time-out sign, so they knew that this laugh was actually anger and not to wind me up, because I couldn't control it. And I still struggle with it, to be honest. I'm irritable. Can vouch for that. And I'm impatient. Things were never done when you needed them to. When you rely on someone for absolutely everything, from the most undignified parts of living, that's been a terrible legacy, really, is my impatience, and I can't control that either. I get terribly impatient, irritable, insecure mood swings, depression, post-traumatic stress. I believe that if you start to accept too early your state after a stroke, you'll never progress. You just plateau, like the medics say. I don't believe, I'll come on to that in a minute. I have an unreliable gullet swallow, but I had one beforehand. I've been hospitalised more times than I care to remember in the last 2 years. Social withdrawal, that's a massive issue for all people who have strokes. I prefer to be on my own. I like doing social media. I can be fairly anonymous, I can interact. My personality is the same, but my behaviour is very different. I've had to have the need to distract myself in order to cope with what happened to me, which is why I've written 2 books, set the charity up after 5 months. You know, I'm very busy and I'm trying to educate people about my experience, which a lot of people have similarities with. And I think the integration back into society after I had 8 months in hospital was as hard, and family, as dealing with the rubbish in hospital, to be honest. It was as hard. Very quickly, just take away from this speech, you've got to understand, I believe totally that this idea of the patient plateauing after 1 year, 2 years, it's often said by doctors all over the world, patients who see it as a death sentence, that they get to 2 years, doctor said, I'll never get any better. And they see it as that they're on death row. No one ever stops progressing. The rate and the level of the progression will vary, of course it will, because strokes are all different. But you've got to, if you put the effort in,